We are Black American members of the National Academy of Medicine,
the premier health science organization in our nation.
We are scientists,
physicians,
healthcare professionals,
and public health experts.
We are also sisters,
mothers, wives, and daughters.
We are brothers,
fathers, husbands, and sons.
We are your neighbor. The person in line at the grocery store checkout. The person sitting next to you in church. We are members of the Black community.
Many of us have fought our way into healthcare professions specifically to care for our community.
Many of us have devoted our careers to exposing racism in healthcare.
All of us have focused our careers on improving health for all.
That is why we support the COVID-19 vaccine, and we encourage you to get vaccinated.
Trust in government does not come easily for our community. Too often our health has been ignored and even abused.
It is not surprising that polls show that many Black Americans are hesitant to get vaccinated.
We understand why.
But COVID-19 is very serious.
And it has a devastating impact on our community.
We have come through so much over the years.
Now we are facing another life-threatening challenge.
We must do what we have always done.
We must choose to do what is necessary for our community's survival.
As health professionals, we understand the science.
As members of the Black community, we understand your distrust.
We have reviewed the research.
Some of us have participated in developing the vaccines, designing the studies, and monitoring the results.
And we are confident the research was done correctly.
Many of us have already received the vaccine.
The rest of us will get it when our turn comes.
We encourage you to claim your place in line to get vaccinated.
Do it for yourselves.
Do it for your loved ones.
Do it for our community.
Do it because we should not tolerate one more preventable death.
Coping with COVID and In It Together present Wellness Wednesday, brought to you by the Diabetes Advisory Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with COVID with Trey Taylor.
Well, it is Wellness Wednesday, and that means In It Together SC and the Diabetes Advisory Council of South Carolina present Wellness Wednesday every Wednesday here on Coping with COVID. Good afternoon. I'm Trey Taylor. So the effects of COVID on African Americans using photo voice. That's what we're going to talk about today. What is photo voice? Well, Dr. Coretta, Jenerette, and Dr. Lori Vick will tell us about it and what happens with the results. Thank you, ladies, so much for joining us. I appreciate it.
Thank you for having us.
Thank you. Dr. Jenerette, did I say it right?
One extra syllable could be inserted in there. How about Jenerette?
Jenerette. I can tell by the look on your face that I didn't get it right. Thank you, ladies, so much for joining us. I appreciate it. I look forward to the conversation a little bit later on. Plus, the Diabetes Toolkit and how that can help you help your healthcare team. That's coming up next. My conversation with Patricia Weatherspoon. That and more next on Coping with COVID. But first, your COVID community updates. The CDC says you can now take off your mask if you're fully vaccinated outside and not in a crowd. If you are not vaccinated, including children, the agency advises you still wear a mask outside and inside. Everyone, vaccinated or not, still need to wear masks in crowds. Now, more than half of adults in the United States, 140 million, have received at least one dose of vaccine, and about a third are fully vaccinated. $270 million are coming to South Carolina to help people with their rent and utilities. The South Carolina Housing Stay Plus program will pay 1 year of rent or utilities for March 2020 and up to 3 months of future rental assistance. Now, residents in 39 South Carolina, some of the smaller counties, are eligible. Some of the criteria are on the screen right now. The program opens in May, Saturday. To see if you qualify and how to apply, visit schousing.com/SC Stay+. You can see that information on the screen also. And SC Works is hosting a virtual job fair tomorrow. Several companies have positions in manufacturing, logistics, and customer service in Aiken, Barnwell, Columbia, Santee, Orangeburg, St. George, and Swansea. Visit the SC Works website for more information and resources and register for the event tomorrow, which is from 10 a.m. until 1 p.m. And that link is on the screen. SCDHEC has your most up-to-date list of times, dates, and location for COVID testing, vaccinations, and flu shots in South Carolina. Visit scdhec.gov for more information. Now, for more information on testing and to make an appointment and get your results in less than 48 hours, you can go to gogettested.com. Also, the DHEC Care Line is still open and available. Now, there you can find out about testing, vaccines, organizing a COVID screening at your event or in your neighborhood, also and transportation to get a test. Now, speaking of transportation, if you live in Richland or Clarendon counties, there are paramedics in those counties that are actually doing in-home testing, not vaccines just yet. Of course, we talked to Congressman Clyburn a couple of weeks ago, and he talked about implementing in-home vaccinations. But right now, if you live in Richland or Clarendon County, you can get an in-home COVID test. Also, speaking of COVID tests, there are several locations in and around South Carolina that are offering vaccinations. I'll just talk about a few. The one at Columbia Mall is open 7 days a week, 7 a.m. to 7 p.m., and it's open for anyone 16 or older. You don't have to have an ID. There are sign language and Spanish-speaking interpreters available, and you can drive in or walk up. Also, COVID vaccinations are being held at Lexington Medical Center. Several of those locations have moved from making appointments to just walk-in vaccination clinics. There are a list of vaccination clinics right there on the screen. One of them is in Columbia, West Columbia, on Sunset Boulevard, and that's Brooklyn Baptist Church. Now, also, if you are a vet, the VA is taking care of all of vaccinations. All you have to do is call that number on the screen and set up to take your test if you are a veteran at the VA. Now, another place that's also doing vaccinations, a big site in Columbia, is at Benedict College. That is actually being sponsored by CVS. As you can see, you can make an appointment there. It's Monday through Saturday from 10 a.m. until 4:30 p.m. Bilingual agents are also available there. And several pharmacies in South Carolina, including Kroger. Kroger pharmacies are offering vaccinations. CVS is offering vaccinations. And the CVS that are located in Target stores, they are also offering vaccinations. Online registration for seniors who need some help is being provided by Get Set Up. If you or someone you know is having a challenge with technology and unable to make an appointment, they can go to Get Set Up. If you need a ride to get your vaccinations, the Comet is giving free rides to any vaccination site. So don't miss your shot. Catch the Comet to get your vaccination. Now, if you have been affected by COVID and know someone in your family that has passed away, FEMA is giving reimbursements for COVID-19 related funeral expenses. You can call them. The number is on the screen. You can follow that link and get the information that you need. Now, Richland County Rental Assistance Program is still going on. They still have funds available. Go to richlandcountysc.gov for more information. And the South Carolina Bar Association and SC Legal Services have a collaboration where they're helping landlords or mortgage companies. They have a website for more information. You can see that on the screen also, scbar.org/COVID health. The City of Columbia is offering a 6-month payment plan for anyone that is behind on their water bill due to losing income because of COVID. They also have payment assistance up to 75%. And open enrollment for the Affordable Care Act is going on through August. Rosalind Goodwin with the Hospital Association is going to join us Friday. She says not only can you get health insurance if you don't have it, if you do have it, you can reapply and you may be able to get some additional subsidies. So go ahead and do that also. Black Lives Matter Scholarship Fund is still going on. They've got about $3 million for African Americans. They're giving special consideration to those in the transgender community, single parents and guardians, and those who were formerly incarcerated. You can see that information on the screen also. And we talked with the ladies from Family Resource Center from Camden last week. And they are doing a series of plays to help people understand more about sexual abuse and child abuse. And they're doing auditions. It's the Act Up auditions. That's happening next month. And they said you don't have to have any prior experience. I'm Trey Tailor, and In It Together SC and the Diabetes Advisory Council of South Carolina present Wellness Wednesday every Wednesday here on Coping with COVID. We are actually streaming live on the In It Together Facebook page. Why don't you go over there and hit like and share and follow? They have got so many great resources about diabetes prevention. So check out that In It Together Facebook page. We're also streaming live on the Tailor Made production page. That is the home of Coping with COVID. I would love for you to go over there and hit like and follow and share. Not only will you be able to watch Coping with COVID every time we come on Wednesday, Thursday, and Friday, and then of course on the first Monday with a legendary comedian George Wallace, but you'll also be able to get all of your COVID related updates. Now, please continue to like, follow, post, and share. If you have a question, please put it in the chat. As a matter of fact, I want to say hi to Betty Fisher. She says, good afternoon, everyone. Hey, Betty, thank you so much for joining us. The folks over at In It Together SC are monitoring, and they say hello to everyone. And we are so glad that you joined us also. Hey, don't forget about the Dash for Good Health Southern Style Cookbook. We're giving these away at a Coping with COVID face mask. This is such a great cookbook, easy to understand. It's got some Southern style recipes, but with a healthy twist. All you have to do is put in the chat, I want a Dash for good health, and we'll get your information, your mailing address, and mail this out to you. All right. So listen, minorities, we already know this, have been affected by COVID. We talk about it a lot here on the show. Health, wealth, education, it runs the gamut how Black and brown people have been affected. Well, a program funded by the Robert Woods Johnson Foundation is studying the problems, the issues, the challenges, and today we're going to find out more about it. Dr. Coretta Jenerette is the Associate Dean of Diversity, Equity, and Inclusivity at the University of South Carolina. She joins us today. And Dr. Lori Vick is Associate Professor at USC. Both of them are with the Black Nurses Association of the Midlands and the University of South Carolina College of Nursing, CON. I figured that out. I was just joking with them, but backstage they sent me all of these acronyms. I was like, what is this? They must think I'm smart. I don't know what this meant, but I figured out. I Googled it, but I figured out College of Nursing. Ladies, thank you so much for joining us. I appreciate it.
Thank you.
Thank you.
Absolutely. So tell me about the BNA, the Black Nurses Association.
So I'll start out. So the Black Nurses, it's actually Midlands of South Carolina Black Nurses Association. So we're one of 114 chapters of Black Nurses Associations across the country. Our organization was chartered in July 2019. So we're young, but we're growing. I'm the vice president, and I bring you greetings from our president, Miss Lisa Davis. And she's not able to be with us today, but wanted to extend her greetings to you as well. And thank you for having us be a part of this program.
Absolutely. Absolutely. So tell me, what does the Midlands chapter of the Black Nurses Association, what do you ladies do? And men, because they are Black male nurses.
That's right. That's right. So I'll go again if you want, Coretta. Okay, so our organization does a lot of community-based work. So we're supporting the community in ways that we identify needs. And that's probably kind of what helped lead us to the Photo Voice project. We have 3 strategic priorities: leadership, advocacy, and mentorship. And so we work towards those ends in terms of supporting the community.
Okay, great. And so this project came about how, Dr. Jenerette?
So we are so lucky that we have Miss Lisa Davis at the helm, and she happens to be an alumni affiliated with the Robert Wood Johnson Foundation. And for those who don't know about the Robert Wood Johnson Foundation, it's actually the nation's largest philanthropic organization that's dedicated solely to health. So when the pandemic happened, leadership at the foundation basically decided that they wanted to leverage the numerous members of their alumni network in order to have responses to COVID. So they sent out a funding opportunity to those members of their network, and Lisa thought it would be a great opportunity to leverage their support and our mission in order to do a project. So as we sat around and kind of strategized how we would apply for the funding, we said, well, what about Photo Voice? I'd had some experience working with knowing about Photo Voice, and then we didn't even know we had a member of our own chapter who actually did her doctoral work in Photo Voice. So
Wow.
it came once we learned a little bit more about Photo Voice. It was a perfect match to meet our mission of advocacy, and also Robert Wood Johnson's aim about targeting inequities related to COVID. So
Right. Well, I want to know a little bit more about the project, but first, tell us what Photo Voice is.
So Photo Voice is a very exciting community-based participatory project or strategy in order to get information about a particular topic. And as nurses, we always want to illustrate the patient's voice. That's basically how we're taught. You know, we're taught if you listen long enough, then the patient will basically tell you what's wrong. So if we listen to individuals that are experiencing COVID, they will identify issues that perhaps people didn't think of. So in a more formal way, Photo Voice is a very collaborative project, and it allows people to address a problem, and it explores the community's assets. They're allowed to promote critical dialogue and produce some shared knowledge, and it can engage them in being a part of decision making and problem solving and being a part of affecting change. And the wonderful thing about Photo Voice is that they do it in both words and pictures. So as the name connotes, it's Photo Voice, so it's pictures and words. So we all know that a picture can say 1,000 words.
Yeah.
So we don't leave it just at the picture saying 1,000 words. We actually bring the group together so that they can discuss the pictures that they choose in order to merge the two. So it's almost like a mixed methods project where we bring them together and we have a photo and then they talk about the photo. So we have both the photo and we have their words to match it. So we think it's going to be a very powerful product when the project is completed.
Wow. That does sound great. You know, I love this because, as you said, it uses both photos and voice. And we do know, Dr. Jenerette, the power of a conversation.
Yes.
As opposed to just talking to someone and writing down what they're saying. I mean, this is just much more powerful because, like you said, in the conversation, things will come out that they're feeling, that they're experiencing. And you don't have to translate it because you hear what they're saying.
Correct. Yep. Yeah. And they're coming together in a group. So, so people, we know the power of social support and the power of a group and groupthink, and that now brings me to my job about diversity and inclusion. If we bring this group of people together to talk about their experience, we know they're going to have some things that are very much in common, and we also know that they're going to have some things that are very much different because we're all not the same. So.
And we are the same too. And that's the thing. We are and we are not.
Right. Yep.
Yeah. We're talking to Dr. Coretta Jenerette, the Associate Dean of Diversity, Equity, and Inclusivity at the University of South Carolina. Dr. Lori Vick also joins us. She's Associate Professor at USC. They're both with the Black Nurses Association of the Midlands. Is that the right way to say it? Is it the Midlands chapter of the Black Nurses Association or the Black Nurses Association of the Midlands?
Midlands first.
Look, is it Jenerette or Jenerette?
Jenerette.
I know. I'm just. And we're talking about the study that they are doing, and it's still going on, correct?
Yes.
And this is the flyer of the study. It's Share Your Experiences During COVID-19 in Pictures and Word. It's the Photo Voice project. So you've got a group of people. Roughly how many people, and what's kind of the demographics? Can you share that?
So it is a small group of predominantly women, because we know women are more likely to respond to sitting around talking to other women. Yes, but they're from different areas of the state, definitely all adults, but a wide range of ages, a range of education. So we think we're going to get some really good information.
So what are you looking for? What kind of information are you looking for, Dr. Jenerette? Or
So
Dr.
because it is very participant driven, they actually decide on what's important. So for example, when they first came together, they decide on the assignment. So they decide what theme they're going to go out and take a picture and send it in to represent the theme that they all decided on as a group. So the first theme that they decided on, what are the barriers and challenges that face our community in trying to navigate the resources and or trying to be informed? We know that is so important when it comes to battling COVID. That is such a huge topic. What are our barriers? How do we stay informed? Because if you don't have the right information, you certainly are not going to be empowered to make the right decisions that are going to keep you healthy.
Yeah. You make such a great, and I love talking about where we get our communication, because this is why this show was born. Other than the fact that I was sitting here with two babies and pulled my hair out last March. but because I recognize that a lot of people, there's a huge demographic of people who, like me and you, may not listen to NPR, don't watch CNN and MSNBC. They live and die by the information they get on social media.
Yes.
And we also know there is a huge amount of misinformation on social media, fake news, if you will.
Yes.
And so to be able to disseminate credible information, not only credible, ladies, but long form, where people could have access to newsmakers, national, local, state newspapers who they would not have access to, and can get real-time answers to their questions, was key. So that is a big thing. And then resources. We live in a very rural state.
Yes.
So that's a thing too. I mean, if people can't get healthcare, they sure can't get, access to the stuff that they need when there's a national pandemic.
Yes. All of that you said is exactly some of the barriers that we're anticipating that will be kind of brought to the surface in this project.
Yeah. So how long are you going to be studying this group?
So the project is typically 6 sessions. So as indicated on the flyer, the individuals that are participating really commit to 6 sessions. So the first session is the introduction, and they go over the ground rules, identifying what photo voice is, all of those things. And then for about 4 consecutive weeks, or whatever time period they decide on, in our case it's about 4 consecutive weeks, they decide on their topic, and they go out and collect their pictures and send them back in, and then they talk about those pictures, and then go on to the next week. So it's kind of an iterative process to collect this data and then put it all together at the end. And then at the end, they're able to give feedback on, other people have kind of analyzed this data based on what you've said about this, and these are the themes that they have arrived at. Does this reflect what you all think? So it's a very cyclical process, and they're involved at every stage. It really speaks to the power of the individual's voice in the project.
Wow. In It Together SC and the Diabetes Advisory Council of South Carolina present Wellness Wednesday every Wednesday here on Coping with COVID. I'm Trey Taylor. We're here with doctors Coretta, Jenerette, and also Lori Vick. They're with the Midlands chapter of the Black Nurses Association, and also over at USC. And they're talking about their COVID-19 photo voice project. Let's talk a little bit about the impact on those who actually did contract COVID or were directly affected by it.
So, I was thinking about, we've had a couple of conversations about this recently. The first thing that comes to mind immediately is the vaccination, right?
Yeah.
Access to vaccinations, and the concerns that there may be vaccine hesitancy. And, I think it's more an issue of vaccine access. So, we're hoping that information gets disseminated well, and that this information also the richness of it will be disseminated well. Also, I keep thinking about the grassroots methodology of this process, how it is involving people, maybe people that we would not be hearing from at all if we were not doing this project, and how meaningful that is going to be in the long run in terms of us finding out information, reworking it, understanding it, and then working it to a good end. Right.
Yeah, well, the vaccine hesitancy thing is so big because, I mean, we keep hearing that, especially, you know, as Black and Brown people, the history, you know, we've had with the medical profession. And there are still some people, old school and new school, that not only still grasp onto that Tuskegee Project, you know, for one thing, but then talk about it, you know, spread the bad news, you know, and not saying that it's not true and it's not real, but to your point, Dr. Vick, one, we're starting to hear people more and more talk about, but it's okay. Just like the PSA that we ran at the top of the show from the African American Doctors Association, that it's okay. You know, even, you know, when we think about the sister who was working on Dr. Fauci's team to, you know, help make the vaccine. And I've heard everything from right on to, I don't know her, you know what I mean?
Oh yeah. Yeah. But I think it's interesting that there's a lot of discussion about the vaccine hesitancy in the African American community, but realistically, there's probably more hesitancy in other communities. And that, for some reason, is not talked about as much. Right. I do think we have more problems with access, and then we have problems with hesitancy, even though it is a problem. If I think about the rural community I grew up in, if we're trying to compete to get on a website and get a slot before some of our majoritized peers. We're not going to get on those slots unless we have someone to help us. So I just, even this past weekend, I signed up a community member from the area I grew up in, because there's no way that he had the resources, the know-how to navigate CVS's system, which is very user-friendly for someone who's in front of a computer all the time, but it's not for someone from a rural community that only has a smartphone, that doesn't know how to answer those questions. It's, you know, and then even after all of that, when we signed him up and got the appointment and took him to the appointment, he was still concerned that he would have to pay for it. He thought, and it's free. Yeah. But it's just a lot of those barriers that that people just don't consider. And I think hopefully the Photo Voice will bring some of those barriers to the forefront and be a source that we can look back on and say, never again will we have this issue of not being prepared, because we know. This is not a surprise. We know about social determinants of health, and we know who we should have known and should have been prepared in order to mitigate the problems of social determinants of health, because we knew what group of people was going to bear the brunt of this pandemic. We knew that. We knew that years ago. It's the same thing that happens over and over and over again. So.
Well, you know, it makes such a great point, Dr. Jenerette, because everybody seemed like they're surprised. Oh, Black folks are disenfranchised.
Where have you been?
We over here in the Black community been though. We've been trying to tell you, look, Black health matters.
Yes. I don't know where it came from, but I think it is one of the most telling metaphors that I've come across, and I wish I knew the source, but it talks about we're all in the same storm. with the storm being the pandemic, but some
Right.
of us have yachts and some of us have dinghies.
Yeah.
So we are not all resourced equally. So just because you put something on the mountain doesn't mean all of us can get to it, and all
Yeah.
of us know about it, and all of us see it. So so we have a lot of work to do, and it's not going to happen overnight. But a lot of the outcomes with the pandemic certainly could have been prevented because we already knew it was going to happen. And is like our people say, like my forefathers used to say, when you know better, do better.
You're supposed to. You're supposed to. And Dr. Jenerette and Dr. Vick, I have to ask because this is an amazing project. And my hopes are that if not during COVID, which look, I don't even know how long this is going to last because I mean, we're talking about variants now. I mean, maybe this will help the third or fourth wave of COVID. But if not, then how can we be assured that this project and projects like it will really make a difference? Because we do need to make a difference. Like you said, this should not have been a surprise. I mean, you know, you talk about the gentleman that you helped over the weekend navigate the system. That's why there does need to be more. Just come on in. Just come on in. We don't need to know anything. But here we are a year into the pandemic, and they're just starting to have these just open clinics, so to speak, and really utilizing voices and things of this sort to really tackle. I mean, you're talking about somebody who don't have a smartphone in some of our rural areas. They don't even have internet.
Correct.
So, you know what I mean? So how is it that we can be assured that this, like so many other projects, are really going to make a difference?
So I'll contribute to that a little bit. I think the dissemination is the important thing, right? It's dissemination, how we do it. How do we get it to the neighborhood level?
Yes.
You know, we talk about the community and the community stakeholders, but it's got to be in every single neighborhood. So if that means we need point people in every neighborhood, then that's what we need to do. We've got to find the way that we can reach out and be present and support people where they live.
Yeah, you're absolutely right. You're absolutely right. It is really about each one teach one, each one reach one. As you say, Dr. Jenerette, when you know better, you do better. But then when you know better, what are you doing with the information that you know? And when you get pushed back, because you will, are you going to be strong enough and resilient enough and care enough to just keep pushing?
Oh, yeah.
But no, you know what I mean?
Yeah. Well, we never will give up the fight. Never give up the fight.
And we do have to modify modify that statement a little bit. When you know better, you should do better.
You should.
Because we knew a lot of information about COVID, but the right thing was not done. And a statement I also often use is leadership matters. We have to have the right leaders in place in order to put into practice the things that we need to do to keep us safe. And people have to be empathetic. It has to matter that that we're disproportionately dying. And if it doesn't matter to the people in leadership, or the actions are not going to be consistent with a response to those deaths.
Yeah. And I mean, that goes back to voting. I mean, it goes back to, us making sure that we are involved in the voting process, because we elect our leaders on the state, national, and local level. So not only do we need to have those health conversations, we need to take responsibility for us choosing those people, that will lead us in our nation, in our world, in our communities. So,
yes.
So when does the project wrap up, and when should we be able to hear some of the data that was collected?
So the project will wrap up around the end of May, and we hope that we can start disseminating information shortly thereafter. We're not recruiting people now. We have our participants, and we're moving forward with our sessions. And yes, we hope to wrap up by the end of May and start disseminating some information. And hopefully people will be inspired by this project and replicate it in their own communities. Of course, we focused only on Black South Carolinians in this project, but I mean, we see in South Carolina and also nationally, the Native American population has been devastated by COVID-19. The Hispanic population has not fared well either. So there's a lot of minorities, disadvantaged background people, underrepresented people. It's the same cycle that is illustrated by the premise of social determinants of health. It's those people who are minoritized, that have less power, that suffer the deleterious negative outcomes. So this is just a microcosm of everything else we see in society.
So, Dr. Jenerette, if people in those communities want to replicate this program and do something like it, what can they do? Can they reach out to you guys?
Sure. So we are not the experts in photo voice, but we have a partner who actually is an expert in photo voice. So I spent some time at the University of North Carolina before coming back to my home state. So Dr. Alex Lightfoot is actually our academic partner, and she's an expert in photo voice. She's faculty at UNC Chapel Hill, and she is doing our project along with a community partner, Miss Linda Riggins. So I can certainly put anyone who's interested in photo voice and learning more about photo voice in contact with our partners.
Awesome. So if you represent a minority community, as Drs. Jenerette and Vick say, whether that be Hispanic, Latino, Native American, the Asian communities, people with low economic backgrounds of underserved communities, and you want to be part of a study like this so that you can gain some information so that you can consequently help your communities, whether it be this year during COVID or next year during COVID or whatever the next thing is, because here's the thing that we know, it's going to be something else.
Yes. There are always questions that need to be answered. And I think it's so valuable for the next generation that didn't experience COVID to have some of these artifacts so that they hopefully won't repeat the same things that we've had to go through.
Yeah, it's so interesting. I have a 2 and a 5-year-old grand, and I realize they don't know anything but people wearing masks. That is just so natural for them.
Yes.
And we are living in a generation of kids, people who only know that we're walking around wearing masks.
Yes. Yes. And even when I watch a television show now, it just clicks in my mind automatically. Why aren't they wearing masks? And then I realize that's not anything recent. That's something old.
Right.
So I think even if you lived a different life, I think the wearing masks and COVID has had such a powerful impact on how we live our lives. It makes us question a lot of things that we wouldn't have questioned before.
So awesome. Look, not to mention when you give somebody the side eye in the grocery store. Don't breathe this way.
Yes. Yeah. And please pull your mask up over your nose. Over your nose, please. No. And thank you.
Right. This is doing nothing right here. This does nothing.
Yes. And the other one is, do you not see the signage for 6 feet? Why are you so close to me? Back up.
I had that because look, we can go on and on. There was a guy behind me in Family Dollar the other day, and he was just singing. He had no mask on and singing to the top of his lungs. I'm like, sir.
Yeah.
I had to put up my good church finger, put my little stuff down, and just tip on out of there. I can't. I can't with everybody.
We have to make choices based on the choices that the others choose to make. And I think some of it's intentional. So when we talk about people, these deniers and people that don't believe that COVID's a real thing and don't want to wear a mask, that is intentional. It's not just I forgot my mask in the car or those types of things. So
Dr. Coretta Jenerette is the Associate Dean of Diversity, Equity, and Inclusivity at the University of South Carolina, and Dr. Lori Vick, Associate Professor at the University of South Carolina. Ladies, thank you so much, not only for joining us, but for working with the Robert Woods Johnson Foundation to put together and to do this really incredible research. And it's my hope and prayer that it will affect some change if not for this generation, just definitely for future generations, because we need to figure out how to bridge the gap, in healthcare. Absolutely. Thank you, ladies, so much. I appreciate you.
Thank you. We enjoyed it.
Thank you. Thank you so much. All right. So listen, coming up next, we are going to hear from Dr. Patricia Weatherspoon. She's going to discuss the Diabetes Toolkit. It's a project implemented to help you and your healthcare team, and how you knowing about it can help. You've got to be an active participant in your healthcare. We're going to talk about that and more next on Coping with COVID. In It Together, SC and the Diabetes of South Carolina present Wellness Wednesday, every Wednesday here on Coping with COVID. We'll be right back.
Tamika Isaac Devine is running for mayor of Columbia, South Carolina. Do you have questions for her? Want to know her campaign platform, her plans for the city of Columbia, her views on COVID, and more? Check out the Divine Listening Session, 2 p.m. Thursday, April 29th.
Hi, I'm Tamika Isaac Devine, candidate for mayor of Columbia, South Carolina, and I look forward to answering your questions and sharing my vision for the city of Columbia. So join us for Coping with COVID on Thursday, April 29th at 2 o'clock.
Don't miss it. The Divine Listening Session, your chance to talk one-on-one with City of Columbia mayoral candidate Tamika Isaac Devine. Thursday at 2 on Coping with COVID on Facebook Live.
Coping with COVID with Trey Taylor.
The Comet gives me a reliable source of transportation.
It's very convenient to me, and they have wonderful drivers.
It's clean and it builds community. It's fun to meet people.
It makes me feel like really independent. It's just fun.
It's always going to be there and it gets me everywhere I need to go.
We try to ride every single day. Comedy is our livelihood.
Visit Javis Tax Service today, 803-419-1001.
Computers, they're a part of our everyday lives. But when they're not working, they're an everyday problem. So call Computers Unique, your everyday solution. 803-351-5821. Is your computer running slow? Won't turn on? Do you need a screen replaced? Or maybe you just need another computer? Well, Computers Unique is your one-stop shop for all your computer needs. They have a wide variety of new and pre-owned PCs, Macs, and tablets. So call Computers Unique, Dutch Square Mall. 803-351-5821. 803-351-5821. 5821.
I just arrived to get my COVID shot, and this is one shot I won't block.
Gratitude to a great ball club for a courageous effort.
No Celtics were harmed during my shot. Let's do this together. To learn more about vaccines, visit cdc.gov.
Thank you so much for joining us for Coping with COVID. In It Together SC and the Diabetes Advisory Council of South Carolina present Wellness Wednesday every Wednesday here on Coping with COVID. I'm Trey Taylor, and we talked to Dr. Patricia Weatherspoon earlier this week. She's the Associate Professor of Family and Preventative Medicine at the University of South Carolina about the Diabetes Toolkit. Dr. Weatherspoon, thank you so much for joining us today.
Oh, I'm so happy to be here.
Thank you. So first of all, what is the Diabetes Toolkit?
Well, it is an opportunity to be a primer, kind of a prompt for the physician or the PA who's utilizing the toolkit. Because what happens, providers are just inundated with so many things they need to do for different conditions. And depending on the specialty, it can be a little bit overwhelming. So we were hoping if we could put together something that would be a guide as well as a prompt, because we're going to tell you who should be screened, when to screen them, and then after that, once they turn out to be positive, where you can send them. So that's what's really nice about this very encompassing toolkit.
Right. So it's basically for giving doctor, physicians, nurses, healthcare professionals resources. I guess it's resources to help those who have diabetes and prediabetes.
And that's correct, because what happens, we know that diabetes is at epidemic proportion. When we think about in the United States, how many individuals have diabetes, it is overwhelming. And then when we make it real personal, coming home to South Carolina, we feel estimating about 14% of the South Carolina population has diabetes. So then when we think about pre-diabetes, I like to think about it as that warning, before you're actually diagnosed. We now have identified a condition to kind of alert you, this is what you can do before an individual develops diabetes. Because too often conditions come on you and it's too late. So this is before the horse is out of the barn, kind of say, is that we can now say, who is at risk and how prevalent is this? Well, again, in South Carolina, we believe about 37% of the citizens in South Carolina have prediabetes. And unfortunately, a large portion of them are unaware that they have it. So by having the providers know, hey, these are the individuals who are at risk to develop this condition. And then after we tell you who's at risk, let's test them and so on. So that's what's really nice about this.
So Dr. Weatherspoon, is this not stuff that a provider would already know? Or is this just updated stuff just in case they don't know?
A little bit of both. Again, depending on when they trained. When I trained in medical school, there was no term pre-diabetes. I used to tell patients, you're not quite there yet. You just got to touch your diabetes. But about 10 years ago, we decided to designate it, coin the phrase, and then with that, now we know what to do. So depending on when that provider went through school, it may not be something that they should know. Well, I take it back, that they did know in the past, but they really should know now. We've been doing enough for them to be aware of it.
Awesome. Dr. Patricia Weatherspoon joins us. She is a clinical associate professor of family and preventative medicine at the University of South Carolina. Talking about the South Carolina Diabetes Toolkit, we're going to get into it in just a minute. But Dr. Weatherspoon, I want to ask, how can patients utilize the toolkit? Is this something that they can tell their physicians, hey, I heard about this, can you check this out?
That is an excellent. And that's what's so nice about this toolkit. By being on the webpage, it may not necessarily be the physician or the provider to always remember, but sometimes it's the patient to be empowered to know, hey, do I have these risk factors? And there's several tools. We have one on this toolkit that are out there assessing your risk for prediabetes. And they can check it, if they are between the age of 40 and 75. And if they happen to be one of the racial ethnic groups, African American, Latino Americans, Pacific Islanders, because these groups have an increased risk for developing diabetes as well as pre-diabetes.
Right.
Do they have hypertension, hyperlipidemia? These are conditions that we pull those risk factors together. We're saying the more you have, the greater likelihood you should be tested because your risks are high.
Yeah. So I love that, it's our responsibility as the consumer, as the patient also, because again, we may be going to a new doctor or may have moved in a different place or may not have gone to a doctor, especially during this COVID year. A lot of people weren't even going to their physicians. And so they may have, when they pick up that COVID-15, which I like to say is a COVID-50, they may start feeling some symptoms. Because you know what the other thing is, I was talking to someone yesterday. We often see commercials for medicine, different medications say, ask your doctor about this treatment.
And so we're saying the same thing. Ask your doctor if I should be screened. Because again, if you do this self toolkit, which you can do anywhere, I'm hoping that people start thinking about distributing these at family reunions. Because where else is a better place to go to family and say, we're of this group, you're in that age group. And the other thing I forgot to ask, and probably because it's a little too close to home, is that if the BMI is greater than 25, then that is a reason to also check. And so what better place where we're having these beautiful spreads at family reunion, gathering your family, the people you love, and you want to be able to, I can help you before things get too badly. Because too often, many of us are either directly touched by diabetes, have a family member with diabetes, and typically it's a negative connotation because you think about the kidney failure, the amputations, the blindness. And so to have, and this is what I get excited about, to have something that we can intervene so earlier on, it's a blessing. It really is.
Yeah. And the other thing is, you just touched on, at a family reunion, somebody at the family, probably a lot of people probably had it. So if it's a family trait, if grandmama, great grandmother, and I've said this on this show before, that every other generation of women in my family had diabetes, every other generation. Wow. And I remember growing up, it didn't get me. It got my brother. He was the first male. It didn't get me. It got my brother. But it's interesting that I remember going, because I grew up in New York, coming down south to my family's house, and they would always have that peppermint on that dining room table, so that if their sugar dropped, they could grab that peppermint. I mean, that is just such a vivid family memory that I have.
No, that is incredible, and you are lucky.
I am.
One thing that is, I don't want to try to depress people because I think about it, and my sister, who was recently diagnosed, is that we start screening at 40 and 50, but when an individual, any individual, turns the age of 65, the chances of getting pre-diabetes again increases just by the age alone, because the body mechanism, the pancreas gets a little tired and it's not able to pump out the amount of insulin. And so just by being blessed enough to live to 65 puts you at a risk. So it's everywhere.
Yeah, and listen, don't applaud me because I have had, look, I love a chocolate chip cookie and I love some baked bread. So I know that means I've got to be more conscientious about, and I'm a big water drinker, and I do get my exercise. I mean, this last year, has been a change in my life personally, in addition to COVID. So, but I'm just conscientious about it because I do know how it has affected my family and how it does affect us, particularly as African Americans. And I want to live a good life. I want to live a good, long, healthy life. So I'm such a big proponent of, we have got to take responsibility of us. We can't just say everybody had it and I'm going to have it too. You can be the change.
Oh, you really hit that there, because that was the bad part about diabetes is fatalism.
Yeah.
It's inevitable. I'm going to get it, so I'm going to eat what I want and be happy because I'm going to get it, and I'm going to end up like Uncle Joe. And it doesn't have to be that way. Now, I have to put a disclaimer with the toolkit and with pre-diabetes. We're trying to intervene earlier, make changes. Now, one thing we have definitely shown that if an individual was identified with pre-diabetes, and we then start the treatment, one of the incredible treatments is a full, total, comprehensive life coach. And that's the National Diabetes Prevention Program. And so we work with individuals' diet planning, we work with physical activity, because we have found that if a person were to lose as little as 5 to 7% of their weight, they can reverse this. And by reversing it, there are some individuals that will never get diabetes. There are a portion of individuals that still will have diabetes, but it's so much further down the road. And there's even one study that shows if you were diagnosed with pre-diabetes and you had the lifestyle coaching, your consequences, or I'd say side effects down the line, are actually even lessened. So being a participant of a pre-diabetes program has long-lasting effects.
Which, by the way, I'll say is free. Is being offered virtually and at no cost, through In It Together in the South Carolina Diabetes Advisory Council. Dr. Patricia Weatherspoon joins us. She's talking about the South Carolina Diabetes Toolkit. She's a clinical associate professor, family and preventative medicine at the University of South Carolina. Let's get into the toolkit, Dr. Weatherspoon. Now, this is the first thing about the toolkit. Tell us about this.
Right, because, we want to have providers have a reason to use it. And it's sad that I can't just say it's the right thing to do, but I want to give these providers a little carrot. If they actually would go through the toolkit, utilize the toolkit, we can provide them with some credit. Every year we have to have some evidence of continued education. And so this is an opportunity for us to provide you some free credits towards something you need anyway.
Oh, that's cool. So the providers are actually getting something to utilize this. So that's good.
Yeah, we're incentivizing a little.
Yeah. Now this is the introduction.
Right. And this is letting the user, whoever is taking the opportunity to open this up, to see how it is divided, how it is utilized, showing you steps on how to screen. And we give you an actual example of that can be reproduced. And that's what we want people to know. This is a toolkit that is very user-friendly. We have no holds on it. You can replicate any part of this to put into your office that you find to be necessary.
Awesome. And then the next slide we have.
At the end, and this is your ability on how you can obtain that credit. And it may be 1 credit hour or 2 credit hours, depending on your specialty or your area of training.
All right. The South Carolina Diabetes Toolkit, of course, we've also been showing this, the introductory throughout the show. And this kind of just basically is an overview.
That's correct. It is an overview letting you know kind of pictorially as well as in descriptive what is involved. And so those sneakers and apples, eating well, all of those things. And then, of course, it requires a little measurement, knowing how well you're doing. So all that to show that it's no hidden agenda. This is what we're trying to do from the onset.
So basically, providers have the opportunity now. How do they get to know about it? do they just know about it? Is it just kind of being pushed out to providers throughout the state?
And that is exactly what we're trying to do. We're trying to push it out because it may be the best held secret. And so we're doing things like this forum right here, which is awesome for us.
Thank you.
And then we are also going to annual meetings, professional meetings, letting them know this toolkit's available to them. At one point, we hope to put some billboards, but more importantly, we want people to think about prediabetes, and then we want providers to know we're not just adding to your load, we're showing you how you can weld this into your practice. Just make it so part of your workflow that it's not an intrusive thing.
And I think, to an earlier point, that's why it's even good that the consumer, the patient, can tell the doctor about it, because if the doctor doesn't know and the consumer does know and is being proactive about their health, don't you agree that the consumer can say, hey, I heard about this. Can you check this out? Is this something that would be advantageous for me?
Absolutely. And that is why we're taking a two-pronged approach. We want to let the consumer know, equally the same time we want to let the provider know, and we're also letting health systems know. We know if we can get the hospital systems, because many of these providers are employed. And so if the hospital system sees it as something that their providers need to know, as well as their employees. That's been something that has come about this, is that you have employees that are looking at lost wages or lost opportunity and productivity, and they are now getting behind, let me identify this in my employee population so I can make them healthier. So it's a win-win. And we are taking all those opportunities to introduce this toolkit.
Awesome. So it's the South Carolina Diabetes Toolkit, your opportunity to be proactive about your health. Let your physician know about the Diabetes Toolkit. It could be helpful for you and maybe some of your family members. Dr. Patricia Weatherspoon, Clinical Associate Professor of Family and Preventative Medicine at the University of South Carolina. Thank you so much for joining us today and walking us through this incredibly helpful resource. We appreciate you.
It has definitely been my pleasure. Anytime that we can make consumers be more informed and also help providers stay on top of things, it's a good day. Thank you.
All right. I'm Trey Taylor, and In It Together SC and the South Carolina Diabetes Advisory Council of South Carolina presents Wellness Wednesday every Wednesday here on Coping with COVID. Listen, if you have a story or initiative that can help someone cope with COVID, please go to the Tailor Made production page on Facebook and inbox me. I would love to talk to you about promoting you. If you have a product or service that can help someone cope with COVID, please email copingwith@treytaylor@gmail.com, and you can be a proud sponsor of Coping with COVID, just like our Wellness Wednesday sponsors, the Diabetes Advisory Council of South Carolina, and In It Together SC, and all of our other sponsors. Now, coming up tomorrow, the Divine Listening Session with Columbia mayoral candidate Tamika Isaac Devine. She is going to join us tomorrow. If you have a question or a comment or anything that you want to speak with Tamika about, she's going to be on the show tomorrow for the Divine Listening Session. And then Faith Friday with Conley Ann Ragley, she's going to talk about DSS pandemic aid for foster teens, and Rosalind Goodwin with the Affordable Care Act. She's going to talk about that extension. And like I said before, it's not only for you to register for healthcare if you don't have any. If you already have healthcare, you can reapply and you may be able to get some additional benefits. That and more coming up this week on Coping with COVID. Going to leave you with a reading from Jesus Calling. Today is the 28th of April. As you look into the day that stretches out before you, you see many choice points along the way. The myriad of possibilities these choices present can confuse you. Draw your mind back to the threshold of the day where I stand. Jesus stands beside you, lovingly preparing you for what's ahead. You must make your choices one at a time, since each is contingent upon the decision that precedes it. Instead of trying to create a mental map of your path along the day, Focus on Jesus' loving presence with you. Jesus says, I will equip you and give, and as you go, so that you can handle whatever comes your way. He's going to help us handle whatever comes our way. Trust me, God says, to supply you with what you need when, not before, but when you need it. That's your Jesus Calling for today. It is Wednesday, April 28th. I'm Trey Taylor. Thank you so much for joining us once again for Coping with COVID. Until the next time, I wish you peace, abundant blessings. Take care, stay well, be healthy. Don't forget to wear your mask over your nose and under your chin, and get your vaccine too. I'll talk to you tomorrow.
Coping with COVID and In It Together present Wellness Wednesday, brought to you by the Diabetes Advisory Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with COVID with Trey Taylor.